Do you know about the influenza virus? If your answer is no, then let's talk about it. Flu is a contagious respiratory illness caused by influenza viruses that infect the nose, throat, and sometimes the lungs. It can cause mild to severe illness and at times can lead to death. Before we start, please like and subscribe to our channel and hit the bell icon to get new updates. Influenza is a viral infection that attacks your respiratory system, your nose, throat, and lungs. Influenza is commonly called the flu, but it's not the same as stomach flu viruses that cause diarrhea and vomiting. Influenza flu can cause mild to severe illness and at times can lead to death. Flu is different from a cold. Flu usually comes on suddenly. People who have flu often feel some or all of these symptoms: fever or feeling feverish or chills, cough, sore throat, runny or stuffy nose, muscle or body aches, headaches, fatigue, tiredness. Some people may have vomiting and diarrhea, though this is more common in children than adults. It is so irritable. It's important to note that not everyone with flu will have a fever. Most experts believe that flu viruses are spread mainly by tiny droplets made when people with flu cough, sneeze, or talk. These droplets can land in the mouths or noses of people who are nearby. Less often, a person might get flu by touching a surface or object that has flu virus on it and then touching their own mouth, nose, or possibly their eyes. This is the main reason flu viruses are spread. Treatment of influenza in cases of mild or moderate illness is supportive and includes anti-fever medications such as acetaminophen and ibuprofen, adequate fluid intake to avoid dehydration, and resting at home. Cough drops and throat sprays may be beneficial for sore throat. It is recommended to avoid alcohol and tobacco use while sick with the flu. Aspirin is not recommended to treat influenza in children due to an elevated risk of developing Reye syndrome. Corticosteroids likewise are not recommended except when treating septic shock or an underlying medical condition, such as chronic obstructive pulmonary disease or asthma exacerbation, since they are associated with increased mortality. If a secondary bacterial infection occurs, then treatment with antibiotics may be necessary. The antiviral drugs amantadine and rimantadine have beneficial effects on cases of influenza involving the type of virus. However, viral resistance to these agents has been observed, thereby reducing their effectiveness. A newer category of drugs, the neuraminidase inhibitors, which include oseltamivir, Tamiflu, and zanamivir Relenza, was introduced in the late 1990s. These drugs inhibit both the influenza and B viruses. Other than this, the standard treatment remains bed rest, ingestion of fluids, and the use of analgesics to control fever. It is recommended that children and teenagers with the flu not be given aspirin, as treatment of viral infections with aspirin is associated with Reye syndrome, a very serious illness. Getting vaccinated each year before winter arrives is the best way to protect against influenza A. A new vaccine is needed every year because influenza viruses change constantly. The flu vaccine is available for everyone aged over 6 months. The vaccine is particularly recommended if you are at risk of complications of influenza or if you live or work with people at high risk of getting the flu. We are working on health-related concepts. Our motive is to ensure your healthy lifestyle. To watch more related videos, stay with us by sharing and subscribing.